I think you have to have, yeah. Thank you for your kind introduction, and I would like to thank Dr. Ibea and the organizing committee for inviting me. The Vascular Access Multidisciplinary team is composed of nurses, dialysis nurses, radiologists, surgeons, nephrologists, and the patient, who is located in the center, but all with the firm conviction that the vascular access is pivotal for hemodialysis patients. Since 2030, we have provided to each patient who had to perform a fistula or prosthesis or have been implanted a catheter as a personal written safeguard of that vascular access. The patients or maintaining hemodialysis treatment receive this information as well. Today, I present to you, this is personal safeguards of the different type of vascular access. A small notebook with is delivered to each patient with a newly created fistula prosthesis. It contains patient's name, the type of arteriovenous fistula or prosthesis, and integration date. We also explain why the surgery was necessary and emphasize that fistula prosthesis will play a main role in the future hemodialysis treatment, because vascular access is essential for achieving a good dialysis. Also, the mean to collaborate with all professional hemodialysis team. In the case of the prosthesis, it comprised if the PTF was curved or looped with outer or inner arterial pressure portions. In the next pages, it's a management care displayer with text and pictures explain how they keep the extremity elevated since the surgery procedure finished to prevent swelling and to move the fingers on the hand, but avoiding sudden movement and efforts. The means to maintain a good level of hygiene daily. The tray should be clean and dry, always clean and dry, and only the dialysis nurses staff will take over the fistula and prosthesis curve, monitoring and evaluating its development. Also, it's important to rule out infection and bleeding when they have to, the stickers remove it, and in the case that they had fistula, they need to start doing exercise such as squeezing a small rubber ball. And the proper way to check that the fistula works, and the same information for patients with prosthesis. We teach them how to inspect the fistula regularly, and we give them the message that that fistula or prosthesis must be only used for hemodialysis patients, and how to protect them. No punctures, no arterial pressure, no medication, no vaccines, no blood analysis are allowed on the extremity of the fistula and prosthesis. To be careful while sleeping or moving without hitting its arms, or using a walking stick or scratchers, and to avoid to apply excessive pressure on the fistula, on the arm of the fistula. Avoiding no wearing clothes, watches, bracelets, or compressing objects on the extremity of the vascular access, nor carry handbags. And last but not least, we give the information about emergency situations and contact phones, and also for the prosthesis. Once the hemodialysis treatment starts, we deliver to each patient a new information about the mature fistula and prosthesis as well. It contained patient's name, the type arteriovenous fistula, its creation date, and the first use date with a photograph of that fistula or prosthesis. In these cases, it comprised if the PTF was curved or a loop. Its maintenance care, we explained them when and how to remove the bandage or band eyes to cover the puncture bound the day after dialysis. The importance to maintain a very good level of daily hygiene. They must check the fistula and prosthesis works every day, and to rule out there is infection or bleeding. Also, how to protect them. The same information for prosthesis. Also, we taught them to ease the dialysis nurses to puncture in different places to avoid the appearance of dilatation and fibrosis, and how to make the hemostasis after the needle removal at the end of the dialysis. Emergency situations, contact phones, and a blank page to write down if any problem or incidents occur. Regarding the catheter, the small notebook contained a patient's name, the type of tunnel catheter, its placement and first use date, and a photograph of that. Its maintenance care display with text and pictures, and the importance of not remove the dressing cover catheter until the next dialysis session, and that these dressing catheters must be always drained and clean. So we show them the proper way to have a shower, no submerge, no directly the water stream over the catheter, and if the dressing is wet, use a hair dryer to wet the dress, and we recommend them to take the shower the day before dialysis. It's important also to rule out infection and bleeding. The message that the catheter is only must be used for hemodialysis use, and the days they come for dialysis to use comfortable and loose fitting clothing to make it easier for the dialysis nurses, principal, especially in the connection and disconnection catheter. How to protect the catheter? No scissors, no razor blades or cutting objects to avoid the risk of accidental risk of cutting, and don't apply excessive pressure with the extremity near the catheter, or when they use for moving sticks or crutches. And it's important to avoid wear neck lasers and suspenders or any object which might squeeze the catheter. And finally, the emergency situations, and you can notice that it's different for the catheter to the prosthesis of fistula, the contact phone, and a blank page to write down if any incidents occurred. Over the following days, we checked if they had understood all the information provided by answering questions or helping them. The patients and nurses staff fill out a questionnaire by the 6th, 12th, 18th, and 24th month. And what happened? We wanted to know the acceptance of the patient of this self-care, and if they are being useful for them, and the opinion of the nursery staff about the impact of their self-care's vascular access on patients. So we conducted a retrospective cohort study with 18 patients who have received a personalized written self-cares of a mature fistula, prosthesis, and catheter from November 2030 to January 2016. 21 were female and 64 were male, with a mean age of 62 years and dialysis average of 3.4 years. 66 patients belonging to our center, and the other 20 patients came from the different centers. 62 patients were not dependent and 60 were dependent patients. The personal self-care vascular access provided were 21 of arteriovenous fistula, 20 of arteriovenous prosthesis, and 44 of tunnel catheters. 63 patients had only one BA, and 25 patients had more than one. And here are our results. We have found a very good acceptance of patients to self-care information in regard to the percentage of the patients along the study. 90% of the patients had read at least once the information provided. More than the 50% of the patients had read it more times. 86% of the patients checked that the fistula and the prosthesis work. 21 patients requested nurse help in relation to vascular access, and more than 19% knew how to care vascular access and when, why, and how to contact us. This table shows us the answers of the patient questionnaire by the 6, 8, 18, and 24 months. And what we found between the different variables. Older patients read less and less time the vascular access information. Dependent patients read less information, knew less how to care, and knew less when and how to contact us. Male patients knew better than female how to care the vascular access. Patients from another dialysis center read less the self-care information. And patients with a catheter and with more than one vascular access had requested more nurses' help, all with the significant differences. Regarding the nurses' staff questionnaire, we have found that although the nurses were initially requested for help and for questions frequently, it decreases over the time. More than 75 of the nurses verified that the patients knew how to check that the fistula and prosthesis work. All of the nurses believe that the patients with fistula and prosthesis knew how to care it, and 86% of the nurses believe that the patients knew how to care its catheter. 16 patients describe us how did they recognize that the fistula or prosthesis work, like a pulse, a beat, a jump, a black steam, a thrill, a tremor, a continued vibration, a movement, trickling, titillation, murmur, a blow. 7 patients contact us during the study period, 4 patients for not feeling the prosthesis work, and 3 patients for having stained the dressing catheter. And in conclusion, personal written self-care vascular access allows the patient the possibility to consolidate multiple times. Nurses have a key role due to their close proximity to the patient. It's necessary to include in the vascular access care anyone in the patient's home environment, and without forgetting that the dialysis patient is essential in the vascular access multidisciplinary team. Thank you for your